Imagine this. A state known for its sunny beaches and vibrant cities is now grappling with a new, alarming surge in COVID-19 cases. But here's the twist. This spike isn't just about the virus itself. It's also tied to a political tug-of-war over vaccine policies that could leave millions vulnerable. California, often seen as a leader in public health initiatives, is now at the center of a brewing storm, and the stakes couldn't be higher. A recently identified strain of the Omicron variant, nicknamed Stratus, or scientifically referred to as XFG, is spreading rapidly across the Golden State. Public health officials are sounding the alarm, pointing to a significant uptick in infections. In Los Angeles and San Jose alone, positive test rates have jumped by as much as 6.3% compared to just a month ago. And statewide, hospital admissions are climbing too, nearly doubling since early July, particularly among older adults aged 65 and above. While this year's summer wave isn't as severe as last year's, it comes at a uniquely precarious moment. The Trump administration's approach to vaccines has introduced complications that some argue are exacerbating the crisis. At the heart of the issue is Robert F. Kennedy Jr., President Trump's controversial pick to lead the Department of Health and Human Services, HHS. Critics say his well-documented skepticism toward vaccines is slowing down approvals for updated shots, leaving many Americans without timely access to protection against emerging variants. Matt Willis, a respected public health expert and former Marin County health officer, captured the frustration in a recent blog post. California is caught in the middle of a COVID surge, with infection rates among the highest in the nation, he wrote. We're stuck in an unfortunate limbo, thanks to an administration that seems unenthusiastic about vaccines. Willis urged those at higher risk, such as seniors and individuals with pre-existing conditions, to seek out available doses immediately, warning that delays in federal policy decisions may impact future availability. The situation becomes even more complex when you consider the role of regulatory agencies like the U.S. Food and Drug Administration, FDA, and the Centers for Disease Control and Prevention, CDC. These bodies are tasked with ensuring the safety and efficacy of vaccines, but they currently find themselves navigating turbulent waters. Updated vaccines tailored to combat strains like Stratus are still awaiting FDA approval, and so far, indications suggest they'll only be authorized for high-risk groups, such as individuals over 65. Meanwhile, the CDC's Advisory Committee on Immunization Practices, a key body responsible for recommending who should receive vaccines, has been thrown into disarray. In June, RFK Jr. dismissed nearly all of its previous members and replaced them with a team that includes several outspoken critics of vaccination. This move has sparked heated debates about whether science or ideology will guide critical health decisions moving forward. And this is the part most people miss. Even though the current generation of vaccines remains accessible to almost everyone, once the FDA finalizes its ruling, those options may vanish entirely. For states that rely on CDC guidance, which include roughly 18, this creates a confusing and potentially dangerous gap in coverage. In response to growing concerns, the Los Angeles County Department of Public Health issued a statement acknowledging the delays caused by shifting federal policies. Updated COVID-19 vaccines have been delayed this year due to changes in federal guidelines, they told the Los Angeles Times. This means availability in September might not align with what people experienced last fall. On the surface, the HHS appears to be taking steps to reassure the public. A spokesperson emphasized their commitment to providing safe and effective vaccines while minimizing disruptions. We will collaborate closely with federal and state partners to safeguard public health, they told Politico. Yet, skeptics question whether these assurances are enough given the broader context of uncertainty surrounding vaccine distribution. So, where does this leave us? Is the rise of the Stratus variant simply a reminder of how unpredictable viruses can be? Or does it highlight deeper systemic challenges within our healthcare system? Could RFK Jr.'s leadership represent a turning point or a potential roadblock for vaccine advocacy in America? And perhaps most importantly, what can ordinary citizens do to protect themselves and their loved ones amidst these shifting dynamics? These questions aren't just rhetorical. They demand answers. So let's keep the conversation going. Do you think the current administration's stance on vaccines strikes the right balance between caution and innovation? Or does it risk undermining years of progress in combating infectious diseases? Share your thoughts below. We'd love to hear from you.